Welcome to Mega Wellness Summit. I'm your host, Nikki Jencen. Today we have a special presentation by Dr. David Clark, who found functional medicine 20 years ago during his journey to change his own health and poor habits. Before obtaining his Doctor of Chiropractic degree, he studied the use of herbs and nutrition as methods to improve health without drugs and surgery. During his chiropractic doctorate program, he fell in love with functional neurology, the science of treating the nervous system and neurological problems without using medications. After earning his Doctor of Chiropractic, Dr. Clark continued learning so he could serve patients at the highest level possible. Dr. Clark is a board-certified functional neurologist, fellow of the American Association of Integrative Medicine, clinical nutrition diplomat, and fellow of the American Board of Vestibular Rehabilitation. Dr. Clark has lectured at chiropractic colleges, medical schools, and private schools on topics such as celiac and gluten sensitivity, autistic spectrum conditions, thyroid disorders, and autoimmune conditions. He has appeared on television numerous times and has been quoted as an expert for his work with complex chronic conditions. His popular YouTube channel has over 1.8 million views and over 8,000 subscribers. Doctors from all 50 states consult with Dr. Clark for help with the treatment and management of patients with chronic neurological and metabolic conditions. Dr. Clark maintains a private practice in Durham, North Carolina, where he treats patients from around the globe, from as far as India, Africa, and the Middle East. His practice focuses exclusively on the sick and hurting of all ages suffering from immune, endocrine, and neurological disorders. Welcome, Dr. David Clark, to Mega Wellness Summit.
Okay, thank you, Nikki, so much for having me here today. I'm super excited to be presenting here for the Mega Wellness Summit. I'm obviously going to be talking about celiac and gluten sensitivity, which is a topic near and dear to my heart because I have celiac disease, as well as treating a tremendous number of patients in my practice who have celiac and or gluten sensitivity. And our topic is going to be how celiac and gluten sensitivity are the gateway to neurological, endocrine, meaning hormone, and immune system diseases. So I've got a lot to share, so I'm just going to kind of jump right into it. So number one, I realize I'm kind of talking to a couple different groups of people. So I know that I'm already talking to people that are diagnosed with celiac or gluten sensitivity. There are people here who think they might have celiac or gluten sensitivity. And then there's people that don't know if they have either one. And then there's also people that don't want to develop an autoimmune condition. They kind of know a little bit about celiac and gluten and how it can predispose you into developing these things. They don't want to get one. And that's who I am talking to today. So I got to cover a lot of different information to make sure that everyone is on the same page and getting the same critical information. Now what we're going to cover is a lot of things. We're going to make sure that we're all are speaking the same language and are up to date. We're going to be defining what gluten is, what gluten sensitivity is, what celiac is, what the best testing is for these things. Because one of the questions I always get asked is, what is the best test to find out if I have a gluten problem? What's the best test to find out if I have celiac? And we're going to answer that. We're going to be discussing how celiac and gluten sensitivity lead to autoimmune conditions, which is a really important thing to understand. It's very important. We're going to define what autoimmune means, because I find a lot of people have a bit of misunderstanding about this. And it is, it's really important that we understand what autoimmune is because, if having gluten sensitivity and celiac wasn't bad enough, what those things can lead to, further autoimmune conditions can be really quality of life threatening. We're also going to make sure you understand the 3 requirements for developing an autoimmune condition so that you can avoid those, or if you've got them, at least you'll know how it happened. And we're going to be talking about the best way to test for autoimmune conditions. And then finally, we're going to be going over a kind of a survey of different common autoimmune conditions that you may have and don't know, or your child or your spouse may have symptoms of these things, and that'll let you know that you need to get checked out. going to let you know how to recognize if you, your spouse, or your children have an undiagnosed autoimmune condition, how to prevent the gate opening, and how to shut the gate if it's already open in your case. And then really the kind of doctor you should be working with to handle these issues effectively and appropriately and quickly. Now, before we jump into kind of the meat of the matter, I want to share with you the very short version of my story, like how I got here. In 2007, I was suffering with atrial fibrillation, atrial tachycardia, and atrial flutter, which basically means I had a heart rhythm problem. It was debilitating. I was missing many days of work at my practice, and a lot of times I couldn't even stand up because I would basically pass out. That led to me getting this thing called a radiofrequency catheterized ablation done, kind of a heart procedure in 2007. And in 2008, I was diagnosed with celiac disease. Now, like a lot of you, if you've been diagnosed celiac, you now look back at other health problems in your life and you now have a brand new perspective, and that's what I had. A lot of things made sense that hadn't made sense before. So I was diagnosed celiac, but I also tested positive for some things we'll talk about later called GAD65 antibodies, as well as transglutaminase 2 antibodies. So it means not only did I have celiac, but I had a couple of other autoimmune problems. And I've been gluten and milk free since that time, 2008. Now, that really affected my practice in such that I guess, you attract to your practice, who you are. About 90% of my patients in my practice have autoimmune diseases, or some of them don't even know they have it yet. Now, the big bulk of that are people with women with Hashimoto's and low thyroid. I've also treat people with something called SIBO, which is small intestine bacterial overgrowth. Treat a lot of patients with celiac, irritable bowel syndrome, ulcerative colitis, and Crohn's. A lot of women with hormonal irregularities such as PCOS, which is polycystic ovarian syndrome, infertility, menstrual irregularities, rheumatoid, Sjogren's syndrome, lupus, and a big chunk of kids with autism, Asperger's, and neurodevelopmental conditions like PDD and ADHD, dyslexia. And then over the last 2 years, I've been treating a lot of girls of all ages with Gardasil vaccine injury, which, believe me, we could talk for several hours just on that. So that's kind of how I got here. So this is what I live and breathe every day. I'm not just like a researcher. I'm a clinician. These are the people I see and treat. I now got to make sure, though, that we're all on the same page. So we're just going to take our time for a minute and talk about some different definitions so that we all have a current, up-to-date, modern information on what these things are. So let's begin with what is gluten anyway, right? Now, you're going to find out that gluten, when people say gluten, they don't really mean gluten. So just bear with me. So I want to give you this diagram. Here we have wheat. It's whole wheat. And there's two major things in wheat that we're going to mention. There are what we call, proteins. And then on this other side, we have these things called lectins. Now, the major protein in wheat is this thing we call gluten. And the major lectin is this stuff called wheat germ agglutinin. Now with gluten, gluten is actually made of two different proteins. One is gliadin and the other is glutenin. Now gliadin actually has three different components of that. There is alpha gliadin, gamma gliadin, and omega gliadin. So already, this is more complicated than you probably thought. When people say gluten, they don't really mean wheat. They mean something that's in wheat, and gluten really is made up of these two things, gliadin and glutenin. Now when you eat gluten, it is acted upon in your small intestine by this enzyme that's called transglutaminase. Now when you get gliadin and you run it through this transglutaminase, you get this stuff at the end that's called deamidated gliadin. Now, I don't mean to say all this to get super technical, but I just want you to know that these things I'm showing here on the slide, these are all things that you can have an immune system problem with. Now, what I really want you to take away from this is that for all practical purposes, when people or labs or your doctor says gluten, now whether they know it or not, they're talking about this right here, alpha gliadin or gliadin, however you want to pronounce it. They're not talking about glutenin or really gluten, they're saying gliadin. So it's kind of a misnomer to say gluten sensitivity because most people are talking about gliadin. Now, as I just said, that's the practical purposes. Now, here's the real problem with this kind of single-mindedness or this small focus. Almost all labs that I know of, I mean LabCorp, Quest, I mean you name it, anytime you hear them say gluten testing, what they're really checking for is only alpha gliadin. And that is a big problem. And here's why. You can have a problem with any of these things I've been talking about, and only this thing. For example, you could have a problem only with wheat, whole wheat. You could have a problem only with the gluten that's made up of these proteins. You could have a problem only with wheat germ agglutinin. You could have a problem with glutenin. You could have a problem with these 3 different kinds of gliadin. You could actually only have an immune system reaction to gliadin once it binds to this transglutaminase stuff. Or you could have a problem just with deamidated gliadin. So the problem is this. If a lab is only going to check, if it's only going to check this alpha gliadin, then the problem is you're missing the big picture. Because the big picture is you've got all these other things that you could have a problem with. And if you only get checked for alpha gliadin, then, and that's negative, that doesn't mean you don't have a gluten problem. It doesn't mean you don't have a wheat problem. It just means you didn't have a problem with that particular part of wheat that they checked. And this is why a large number of people get missed. You know, their well-meaning doctor runs these tests from LabCorp or Quest or whatever, and they only check one small bit, one small percentage, and they get missed. And that's a big problem because a lot of times the doctor will say, hey, you know, Mrs. Jones, this is great. You don't have a gluten problem. You can go ahead and eat gluten. And that is wrong. I just know the way to put it. That is wrong. Mrs. Jones, that does not mean you don't have a gluten problem. It just means you didn't have a problem with that one particular piece of wheat. So you've got to get proper testing, which I'm going to talk about, you know, in just a few seconds. So that's the problem. That's kind of what gluten is. It's alpha gliadin, unless somebody says, you know, specifically they mean something else. And when you're getting tested for just alpha gliadin, you miss the whole picture. All right, so let's talk about what celiac is. Celiac, really, the definition depends on who you ask. I like this quote from a journal that just came out this year that says, celiac is a systemic autoimmune disorder which occurs in genetically predisposed individuals due to ingestion of gluten and related proteins present in wheat, barley, and rye. Let's look at that again. It's a systemic autoimmune disorder. Systemic means body-wide. Now, what does autoimmune mean? Autoimmune means that your immune system is mistakenly attacking your own cells and tissues. Okay? That is a really good basic definition of celiac. Now, if it's an autoimmune disorder that's, you know, instigated by a genetic sensitivity to wheat, barley, rye, the first tissue that gets attacked in celiac is the small intestine usually. And this is why labs do blood tests that look for antibodies that are associated with the small intestine. Now, they look at these things called anti-endomysial antibodies or transglutaminase antibodies. So let me just give you a little graphic about that. So here's a little slide that kind of is a microscopic slide of your small intestine. Now, an antibody, the best way to think about that is like this flashing adhesive strobe light that your immune system makes to stick onto something that your immune system thinks is an invader. And remember, in an autoimmune problem, your immune system thinks that one or more tissues are an invader and need to be killed. So once this antibody for something in the small intestine, be it transglutaminase, which is an enzyme, or endomysium, which is a little layer of tissue in there, once the antibody is there, it attracts your immune system soldiers, and they try to kill that target. You can also look for these things called reticulin antibodies. So these soldiers, once they find the antibodies, they start destroying it. That is a really good way to think about the blood test for celiac disease. Since celiac mainly starts in the small intestine, you've got these antibodies that look at the small intestine. Now, there's also blood tests that they'll do for celiac that just look for your reactivity or your reaction to, quote, gluten, which remember is alpha-gliadin. Now, in the last couple of years, labs have started looking at not only alpha-gliadin antibodies, but they started to look at deamidated gliadin antibodies, which is, can be a little more helpful. But it's the same situation. They're either looking to see if you have antibodies targeting your small intestine, or do you have antibodies specifically for these two things of gluten. But here's the thing. Even if it's just these two pieces, they're still missing 7 or 8 other things that you could have a problem with that could still be causing you symptoms, but they're just not these two things that they're checking for. And of course, we just talked about them destroying it. So these blood tests for celiac basically look for, back to our chart so you can kind of see it, they'll look for alpha-gliadin or they'll look for deamidated gliadin. Now this leads me to to tell you a very, very important point. And that important point is that most people still, even today, even doctors, think that if you've got a problem with gluten or celiac disease, and maybe you think this, is that you would have gastrointestinal symptoms like diarrhea or cramping or bloating. And I just want to tell you that is not correct. It's kind of an urban myth. It's just not correct. Here's some critical knowledge for you. And this is a quote from a paper, a research paper. And it says the ratio of extraintestinal, meaning things not the intestine, to classical symptomatology is 8-to-1. And here's the key. Thus, the vast majority of patients have silent celiac disease, and the condition does not present with overt GI symptoms. So take a second and let that sink in. 8-to-1, meaning if you've got celiac disease, there's an 8 times greater chance that you will not have GI symptoms. Instead, you're going to have symptoms that involve your hormone system and your nervous system. Now, this quote comes from 2001. We've known this for 14 years, yet unfortunately you go to your family practice doctor or your chiropractor or whoever, most of them are going to think that, hey, if you don't have any GI symptoms, then you can't have a problem. That is just not correct. So these symptoms of celiac disease, I want to just give you another chance to let that sink in. Gastrointestinal symptoms are the least common signs of celiac and gluten sensitivity. Least common. Least common. The symptoms of celiac that are most common are neurological and endocrine. For example, these kinds of problems: hypothyroidism, infertility, PCOS, polycystic ovarian syndrome, infertility, facial hair, acne, lack of periods, migraines, seizures. Yes, seizures. And behavioral problems, cognitive problems like ADHD symptoms, brain fog, and neuropathy. Now, neuropathy is when you get pins and needles and weakness that are associated with peripheral nerve injury. Here's some more critical knowledge for you, okay? I'm going to get to it now. Celiac disease is only one kind of gluten sensitivity. It's not the only one. This is another really big mistake that a lot of well-meaning doctors make. They say, well, your celiac test was negative, then you must not have a gluten problem. Again, that's completely untrue. That is not accurate. And here's the way I want you to think about it. Celiac disease is only one kind of gluten sensitivity. It's like that old saying, a poodle is a dog, but not all dogs are poodles. It's the same situation here. Celiac disease is an autoimmune condition in which your immune system attacks your small intestine and can attack lots of other tissues, like I'm going to show you. But it doesn't mean you get gastrointestinal symptoms. Now, the one thing I also want you to know is once you have one autoimmune condition, once your immune system has lost its tolerance for your tissue, the odds are really good you're going to develop another autoimmune condition. That's why a lot of people that have, for example, Hashimoto's end up with another condition, such as rheumatoid arthritis or pernicious anemia, or people that have rheumatoid arthritis end up with another autoimmune condition. Now, I put in parentheses here, unless the odds are good you're going to develop another one unless you do the right things to stop the gate, okay? So that's celiac disease. Let's talk about what is gluten sensitivity. Well, gluten sensitivity is an immune system reaction to wheat, barley, rye, to any of those things I showed you on the big chart, but it's just not celiac, meaning the genetics of it are slightly different, and it's not autoimmune to the small intestine. So gluten sensitivity means you have immune system reaction to some of those components. It could be the gliadin, the glutenin, it could be the wheat germ agglutinin, it could be whole wheat itself. The important thing to know is that your immune system in gluten sensitivity has targeted and continues to target gluten or these proteins as an invader that needs to be destroyed, and this creates inflammation, and that inflammatory environment can lead to the expression of an autoimmune condition. Now, to be totally frank with you, I wish gluten sensitivity I wish no one ever came up with that idea or that name, because people don't take it seriously. They just think gluten sensitive, my tummy hurts a little bit. That's a really, as you might know if you have this condition, that is not accurate at all. I really don't like gluten sensitivity. I wish there was another name for it, but it's unfortunately a lot of people just, they minimize the problem that they can have with gluten or that somebody else could have with it because of the name. Now I want to share with you one other thing. There's actually now evidence to show that there is non-gluten wheat sensitivity. You may have heard of non-celiac gluten sensitivity. Well, now there's something called non-gluten wheat sensitivity. And basically, it's new research has shown that gluten, or the wheat proteins I was showing you about, may not actually be the problem. This is just within the last year. The problem is non-gluten proteins. And we don't have to go over all these, but I just think it's interesting to note that the research is really catching up and saying, you know what, there's a lot of things that could be problematic with gluten. And yes, you can get a lab test, but sometimes the best test is just, how do you feel and how do you do when you eat gluten? Sometimes, people need to get tested to see in black and white, but no test is perfect. I mean, for example, if you had this problem, this non-gluten wheat sensitivity, all your gluten sensitivity tests would be negative. And you might falsely be, tricked into thinking you could still eat gluten. I mean, your celiac test would be negative too. Now that I've been talking a lot about this testing, let me just tell you what I think is the best testing for this. There's a lab called Cyrex Labs, and they have a panel here called Array 3. And this is all the different things it checks for. Wheat germ agglutinin, deaminated gliadin, alpha gliadin, gamma gliadin, omega gliadin, gluteomorphin, which I didn't even talk about, prodinorphin, which I didn't talk about, glutenin, the gliadin transglutaminase complex, and then these 3 different kinds of transglutaminase. And believe me, I could talk to you for hours about this, but if you want to get tested, this is the best test to do that will tell you if you do or do not have a problem with some component of wheat. It is the best, most accurate test going. And just so you know, I don't have any financial interest in this lab. They just have the best test for it. So let's get to the bottom line about all this stuff. So the bottom line is you either do or you do not have a problem with wheat, barley, or rye, whatever name you want to call it. And you either do or do not have an autoimmune condition. Now, whether you use the term gluten sensitive or celiac, all this is basically the same thing. And it means your immune system is having some inflammatory reaction to one of those components in wheat, barley, and rye. It doesn't matter what name you call it. Okay, so that is the bottom line. Let's now move on to why are celiac and gluten sensitivity a gateway to autoimmune conditions? Well, as I said a minute ago, celiac is an autoimmune condition, so it already is the gateway. The gluten sensitivity can lead to autoimmune conditions because gluten sensitivity is inflammatory. And the genes that a person has that, cause autoimmune conditions, and that's a good point I guess I should say, autoimmune conditions are genetic, meaning you have genes that turn on that make your immune system target various tissues and attack them. These genes can be turned on if there's enough inflammation or other factors. So if you've got gluten sensitivity, it's inflammatory, these genes can be turned on by that inflammatory environment. Another thing that's really critical to point out is that gluten sensitivity almost always leads to this condition known as leaky gut, or what we call intestinal hyperpermeability. And in fact, leaky gut is one of the 3 recognized necessary ingredients to develop an autoimmune condition. So here's the deal. You don't want any of those things. You do not want celiac disease. You don't want gluten sensitivity. And the last thing I'll point, the last bullet that popped up there, is this thing called cross-reaction. I'm going to talk about cross-reaction because I need to kind of give you a visual to explain it. Cross-reaction is another mechanism, another way that celiac and gluten sensitivity can lead to autoimmunity. So let me explain that. In cross-reaction, you've got antibodies for one thing. We'll just call it thing A. But they can attach to this other thing called thing B, even though thing B is not actually thing A. So if that sounds like a Dr. Seuss story, let me just show you the visuals of it. So if we say this thing here is a gliadin antibody, right? We're just going to call it gliadin. There's 3 little slots here. And look, here comes gliadin. Gliadin's got 3 things that'll fit right into those slots. So this is just the normal kind of reactivity, we'll call it. Now in cross-reaction, you get the gliadin antibody, but it can stick to something else. And that something else could be your tissues. The tissue there is not gluten, but it looks close enough because it's got 2 of those little prongs that it can bind and then become cross-reactive. So cross-reactive is when the antibody for one thing attaches to a second thing. So let me talk about that for another second. So these gluten and gliadin antibodies can cross-react with your tissues. So what that means is if you've got antibodies to gluten, they can attach to certain tissues in your body and cause your immune system to attack those tissues. Now, most commonly, we know this happens in the liver. It happens with this stuff called acylogangliosides, which are proteins in nerve tissue. And it happens with this enzyme called GAD65. So what this means is, if you have gluten antibodies, they can attach to your liver and make your immune system attack your liver. They can attach to acylogangliosides and make your immune system attack your nerve tissue. And it can attach to GAD65, which is found in your pancreas and part of your brain, and make your immune system attack that. And that leads to autoimmune. That is the definition of autoimmune, when your immune system is attacking that. So those are the couple different ways that the gateway between celiac and gluten sensitivity and autoimmune, that's how that's accomplished. So I've been talking a little bit about the immune system and antibodies. I'm just going to give you a couple quick visuals of kind of how the immune system works. Basically, there's 2 divisions in your immune system. There's what we call T helper 1 and T helper 2. And in a normal immune system, they're very balanced and regulated and coordinated, and everybody's happy. And on this side of the Th1 side, we've got natural killer cells, we've got T helper cells, we've got suppressor cells, regulatory T cells, and it's more complicated than that. But basically, these guys are your soldiers, right? Their job is to protect you from viruses, bacteria, parasites, cancer cells, things like that. Now, what your Th2 does, those are essentially B cells, and they make antibodies. So if you can imagine this thing here as an invader, what the antibody does is it's going to attach to the invader so that the army soldier can come and kill it. And we've already showed you that before. So that's kind of the basics of that. Okay, so autoimmunity, the way I like to explain it to my patients, and I'll explain it to you this way, an autoimmune problem is like an octopus, but an octopus that has 50 legs. Okay? And that 50-legged octopus has its tentacles in every corner of your biochemistry. I mean, it can cause thyroid problems, adrenal gland problems, heart problems, osteoporosis, ovarian problems, testicular problems, endocrine problems, GI problems, liver problems, and neurological problems. It really is the number one priority with every patient that I see, is we have to figure out if they've got an autoimmune problem. And since you've got this autoimmune octopus has got its tentacles in like all different parts of your biochemistry, it can produce a lot of different kinds of symptoms. I mean, this is just a partial list, but so many people have these symptoms that the point is you've got to realize is that fatigue, weakness, headaches, brain fog, all these things here, you could have an autoimmune cause for those. And it needs to be assessed, it needs to be checked out. Now, some people say, well, how common is an autoimmune condition? I mean, how many people actually have this? I mean, how common is it? Well, the American Association The American Autoimmune Related Diseases Association estimates that up to 50 million Americans suffer from an autoimmune disease, and that prevalence is rising. Now, I want to put that in perspective for you. In comparison, cancer affects up to only 9 million people, and heart disease affects up to 22 million people. It's so common that 1 in 9 women and 1 in 12 men have an autoimmune problem. Now, another way to think about it, this information came out a couple years ago, is that over 32 million people in the U.S. have this one kind of antibody, which is anti-nuclear antibody. And it says here the prevalence is higher among females, older individuals, African Americans, and those with normal weight. This is just one kind of antibody that can be found in 32 million people. That's an autoimmune problem, and that is from 2012. So it is extremely common. I mean, how many of you listening to me have got an autoimmune problem? I mean, the chances are 1 out of 9 of you women do, in fact, have it. It's kind of scary. Now, to even get an autoimmune condition turned on and to actually be causing problems for you, there's a couple different ingredients, and here they are. The first ingredient is you have to have the genetic predisposition, and we don't have time to go into that, but basically people that have what we call HLA-DR and HLA-DQ genotypes are way more susceptible to autoimmune conditions. So that's ingredient 1. The second ingredient is you have to have intestinal hyperpermeability, aka leaky gut. And I've put a little graphic of a brick wall here with holes in it because that's kind of what leaky gut is. If you can imagine the lining of your small intestine like a brick wall with holes punched in it, that is leaky gut. And what happens is it allows large molecules to fall through the wall and trigger your immune system. It's a highly inflammatory thing to have happen. So that's ingredient number 2. Ingredient number 3 is some kind of an environmental trigger. And a technical word for that is an antigen. It's something that stimulates your immune system to respond. So the 3 ingredients for getting an autoimmune condition are a genetic predisposition, leaky gut, and some kind of a trigger. Now I'm going to go over triggers in a second, but just let me tell you this. Some people go their whole life only having 2 of the 3 and never having the third thing and never having the whole soup of things trigger the autoimmune condition. Some people get all 3 very young. Some people get all 3 when they go through puberty. Some people get all 3 when they go through a divorce. So here are some known triggers for the development of those things. Gluten in milk, for sure. I mean, gluten in milk proteins are the number 1 thing that we know about that will trigger type 1 diabetes or juvenile diabetes. It's well known. But other acquired food sensitivities can also do that, mainly through that cross-reaction thing we were talking about earlier. There's lots of different foods that their antibodies for those foods, like for example, if you get an antibodies to like rice or something, those antibodies for rice can cross-react with other things and lead to autoimmunity. Vitamin D deficiency is known to be a trigger. Psychological stress, as I was just mentioning. And then there's the 3 Ps. Puberty, pregnancy, and perimenopause are major times that autoimmune conditions turn on, mainly because of hormonal shifts. But in pregnancy, there's a cytokine shift that happens just naturally. That can be enough to trigger it. And then infections of all different kinds. Viral infections, parasitic infections, bacterial infections. And infections, there's also a cross-reaction mechanism with those because some of these viruses and bacteria have protein sequences that are very similar to protein sequences in your own tissues. And so if your body tries to attack this bacteria or virus, what it can do is also attack your tissues through cross-reaction. Another group of triggers are metals and chemicals. And those are triggers mainly because you develop this thing called a loss of chemical tolerance, which again is a whole other seminar and webinar in and of itself. So these are some well-known triggers that can make you develop make you have the bad timing to have all 3 of those ingredients to develop an autoimmune condition. So let me go through this now. How would you know if you have an autoimmune condition? What are some things that might clue us into that? Well, number 1, you might think you have an incurable condition, like nothing you have tried has worked. You've tried everything. You've tried medication, you've tried acupuncture, you've tried herbs, you've tried all kinds of different interventions. Nothing has worked. Another characteristic of someone with an autoimmune condition is they have relapsing and remitting symptoms, meaning they have symptoms that wax and wane. They might have a good month, then a bad month, a good week, and then a bad week, a good year, and then a bad year, a good day, and then a lot of bad days. They have these relapsing and remitting symptoms. Another good indicator is if you got a pantry full of supplements and herbs and things that you think you now are allergic to or that didn't help you. And if your symptoms are chronic, meaning you have them and they're progressive, getting worse, I'm telling you, these are all pretty reliable signs that you've got an autoimmune condition. In fact, one of the things that I teach other doctors is, look, the longer a patient has been sick and the more things they have tried that have not worked, then the better the odds are they have got an undiagnosed autoimmune condition, or they've got an autoimmune condition that hasn't been treated correctly. Another way to know is this. Do you have one of these? Do you have one of these 3-ring binders or big stacks of lab tests and doctor visits? And, if you've got one of these things, there's just almost 100% chance that what you really have going on is an autoimmune condition that you didn't know you have, or that you have and it's just not been treated right. In fact, I get a lot of these in the mail when I do intake packets on new patients, and I get one of these in the mail. I can almost guarantee you that they're going to have an autoimmune condition. But the good thing is we can help them. So how is autoimmunity detected? I mean, what kind of lab test do you do? Well, basically to detect an autoimmune condition, you do lab testing for antibodies. Remember our little flashing adhesive strobe lights? You lab test for those. And the best test, again, is from Celiac Labs. They have this test called an Array 5 Multiple Tissue Autoimmune Reactivity Screen. And it tests for 24 different tissue antibodies. And it is the best thing going. And if I have more time, I would explain. You do have to have a doctor order this for you. You can't just order it yourself. You have to be working with a doctor that can, order this test for you. Now if they have 3 columns of results when you get one of these back, and abnormal is out of range. Okay, if you have high levels of antibodies for one of these tissues that they test, that's abnormal. And in most cases, high levels of antibodies are predictive of future tissue failure. Now, what that means is although we can't say that you have active disease, but I'm telling you, it almost is 100% sure that if you don't do something, those high levels of antibodies are going to result in destruction of the tissue that they're targeting. So if you do this autoimmune test from Celiac and it comes back that you've got thyroid peroxidase antibodies that are very high, there's a really good chance that if your thyroid is not already being destroyed and making you hypothyroid, that it's going to happen. That's why we call them predictive. Now, this is the last thing I want to mention is the little antibody thing. So let's talk real briefly about the difference between an autoimmune tissue reaction and autoimmune disease. So when you get this Celiac test back, a lot of times the term we'll use is autoimmune tissue reaction. And it's just a little semantic game, because here's the deal. Here's a good example of this. In the standard kind of medical model, you have to know this. When you get autoimmune attack on your adrenal glands and it gets bad enough, they'll call it Addison's disease. But here's how bad it has to get. You have to lose 90% of your adrenal gland before you'll get diagnosed with Addison's disease. But the thing is you've had Addison's disease really up until you lost 90% of your tissue. You've had the symptoms, you've had the autoimmune attack, you just didn't get the label. And that's kind of the problem that I have with the medical model as they deal with autoimmune conditions, is it's kind of a wait until you are bad enough to show definite pathological damage, and then we'll give you a diagnosis, and then maybe we'll give you treatment, which is usually steroids or immunosuppressants. So I just want to make that point that the Celiac test doesn't show that you have a disease. It shows that you have high levels of antibodies, and your doctor has to correlate that with your current situation before you can kind of say, oh, I had high adrenal antibodies, that means I have Addison's. Well, not really. What it means is it's predictive for that, meaning if you don't do something about it, it's probably going to lead to Addison's and full-on tissue destruction. So that's just a point I wanted to make. Now, here's celiac and autoimmune conditions tied together. There's lots of research we could go over. This is from 2007. People with celiac disease are known, we already know this, to have antibodies, meaning they're attacking all these other tissues like thyroid, pancreas, stomach, muscle, bone, brain, nerve tissue, blood vessels. If having celiac wasn't, bad enough in your mind, think about having a thyroid that's not working, a pancreas that's not working, a stomach that's not working, muscle and bone. this really leads to something that can really seriously sabotage your quality of life. And it's already known. So I'm going to give you another little graphic to think about in terms of what an autoimmune condition does to tissue. So you've got this Th1, Th2 thing, and if you get an imbalance in this cytokine, let's just say it tilts this way, you're going to make all these antibodies that are going to attach to a tissue, and look who comes in. Your immune system soldiers start coming in, and they're attacking and destroying whatever tissue that is. Now that tissue could be your thyroid, could be your ovaries, could be bone, could be your brain. But the symptoms you get from the attack, the autoimmune attack, it depends on which tissue is being attacked. And remember, all these different autoimmune conditions get different names based on what tissue is being attacked. But there's hundreds of different autoimmune conditions, and some of them don't have names. They just get, they're just defined by the antibodies that are made. So the symptoms you get depends on what tissue is going to be attacked. So as we go through these next slides where I talk about the specific endocrine problems and neurological problems that are associated with certain antibodies, I just want you to pay attention to the symptoms because this is what's going to help you out. So let's start talking about how there's these gateways to immune diseases. Well, again, celiac is an autoimmune condition. Gluten sensitivity is inflammatory and can lead to an autoimmune attack, and we talked about that using, talking about cross-reaction, as well as triggering the turning on of the genes. Now, third, though, here's another thing. Over time, this immune system reactivity, this activity, can exhaust your immune system. So you can still have an autoimmune condition, but your overall immune system health can be lowered and it can be less competent. Now, a real easy sign to see if that's happening is if on blood work your white blood cell count is less than 5. I can just tell you from hundreds and hundreds and hundreds of patients, if your white blood cell count is less than 5, and there's some research to show this as well, there's a real good sign your immune system's getting exhausted, and you got to ask yourself why. Is it because I have an autoimmune condition that I didn't know about? Okay, let's talk about these endocrine or hormonal diseases. The first one I want to talk about is not really an endocrine disease, but I just think it's really interesting. Bone, okay? There are these little cells called osteocytes. And osteocytes are involved in basically the routine maintenance of your bony structure, okay? If you get osteocyte antibodies, guess what happens? You get osteopenia and you get osteoporosis. Now, I'm sure you know people right now that have osteopenia and osteoporosis, and I would guarantee that if we tested them, probably 20% of those people would show up with these antibodies. This is critical because if that is not recognized, they're not going to get treated appropriately, and their condition's probably going to get worse. Now, I've put down in red here what we already know is that plenty of research shows that there are known bone mass abnormalities, and these two guys right here, in celiac people. Okay, so bone, I just had to mention that one. Let's talk about ovaries and testes. So the ovaries obviously make hormones like estrogen and progesterone, and testes make testosterone. So what happens if you get antibodies for your ovaries? Well, if your ovaries are being attacked, one of the clear things that usually shows up is abnormal menstrual cycles. Either you lose your cycle or your cycle goes back and forth between being heavy to being light. You might spot. If you have an abnormal menstrual cycle length, anything like that, that could be because of this autoimmune attack. And if you're not making these hormones appropriately, then you can start to get depression because estrogen has a lot to do with your serotonin levels. And then another thing that will happen is you will have fertility issues. I have seen so many women, I have lost count, that have infertility problems that ends up being related to an autoimmune attack, either directly on their ovaries or because they've got Hashimoto's. You just have to check for it. If you've had trouble conceiving, you've got to work with someone who knows how to check for these kind of things because it is really common. Now in men, if the testicles are being attacked, a lot of similar symptoms as if it was a woman. You can get fatigue, depression, because what are we not making? We're not making testosterone usually. You get erectile dysfunction. And here's the thing, I always tell people, the younger a man is and the more symptoms he has that are so bad that he has to see a doctor of some kind, the high likelihood is that he's got a testosterone problem, and the testosterone problem is probably being caused by an autoimmune attack on his testes. Something else will happen as these testosterone shifts start to occur and you start to lose testosterone. He can start to get increased fat deposition, especially around the chest and love handles, and he'll end up with low testosterone or low testosterone symptoms. So this has also got to be checked. Rather than just saying, hey, I've got low T, I better go get some testosterone. I think it's really important to do a good workup and find out what is the cause of those symptoms. So the kind of named conditions that'll happen also if you get ovarian damage that's sufficient enough is you'll get this thing called premature ovarian failure. And I just want you to know that there is a very strong link between that condition and Hashimoto's, which is autoimmune hypothyroidism. You also can go through premature menopause. In men, you'll get this condition called hypogonadism, which just means your testicles are not producing hormones the way they're supposed to. You'll get low testosterone, and again, infertility. In 2009, there was a great paper that showed all these people that had infertility problems, there's a high prevalence of infertility issues in people with celiac. So that's ovaries and testes. Let's talk about your adrenal glands. So the adrenal glands, sit here on top of your kidneys, and there's this little enzyme that the adrenal glands use to make a hormone called cortisol. That enzyme is called 21-hydroxylase. It's what you use to make cortisol. Now, I'm just going to tell you straight up, if you're not making enough cortisol because your enzyme there is being destroyed, you can end up with muscle weakness and fatigue, weight loss and decreased appetite, darkening of the skin, low blood pressure, even fainting, like you can stand up and pass out. You start to get salt craving, and you start to have low blood sugar, hypoglycemia. And remember, this condition, this 21-hydroxylase, this is the thing that Addison's is if it gets severe enough for you to get diagnosed. But the thing is, long before you get actual 100% destruction of the gland and you get diagnosed as having Addison's disease, you can have these symptoms right here. So these 21-hydroxylase antibodies, when you start destroying things, they're present years before the onset of the disease. Why? Because the disease doesn't really get diagnosed until you've lost 90% of your adrenal glands. But those antibodies were there long before, waiting for someone, a good doctor, to test and find and get the right treatment. And again, Addison's disease is when you have near total destruction of the outer layer of the gland. But you can also get this thing called adrenal insufficiency, which you may know of as adrenal fatigue. Now, I'm just going to warn you, though, a lot of well-meaning practitioners throw that term around, and they really aren't using it accurately. So you really got to find someone who knows what they're doing and isn't just saying, oh, you've got adrenal fatigue, take licorice root. Because just so you know, that could be totally wrong for you. Also, Addison's and adrenal gland attack is very common in Hashimoto's and vitiligo, which are autoimmune conditions, as well as this condition called atrophic gastritis. And again, in celiac disease, we know that people with celiac disease can and do get adrenal gland antibodies that can cause those symptoms. Let's move on and talk about the pancreas. In the pancreas, you can attack these things called insulin and islet cells. And islet cells are just little clusters of cells, and one of the kind of cells that's in an islet is beta cells. Now, beta cells make insulin, okay? And insulin does what? It gets blood sugar out of your bloodstream and gets it into your tissues. So if you're attacking islet cells or your immune system is attacking insulin, you're going to have blood sugar problems. You can have high blood sugar, but low sugar into your cells, so you're not going to have much energy. You're going to be tired. You can have fatigue. You can have extreme hunger. You can have weight loss if it gets bad enough. I just had a case of this about 2 months ago. A young guy, about 24 years old, developed type 1 diabetes, which is what happens when you destroy your islet cells or your insulin. Now, the symptoms, again, if you get attacked in kids, new onset of bedwetting is like, for example, if your kid's been nighttime dry for 2 or 3 years and all of a sudden they're starting to wet the bed again, you need to get them screened for this, because new bedwetting is a really it's an alarming sign, and it can be indicative of the onset of quote-unquote juvenile diabetes, which is also known as type 1 diabetes, which is autoimmune. That's really what it is. Also, some symptoms like cognitive symptoms, like if you've got low blood sugar, you can be irritable, you can get blurred vision. And again, if it's bad enough, you'll get diagnosed with type 1 diabetes. You can also get diagnosed with, quote, unexplained or idiopathic hypoglycemia, which it's really not explained because you've got antibodies against insulin and islet cells. And you can also get this thing called latent autoimmune diabetes of adults, or LADA. And here's the interesting thing about that. Type 2 diabetes, which is not supposed to be autoimmune, about 25% of people that have been diagnosed type 2 diabetes really have an autoimmune mechanism for their diabetes. So some people are trying to come up with this idea of saying there's type 1.5. You got type 1, which is juvenile, type 2, which is, adult onset diabetes, and there's type 1.5. Well, it doesn't really matter what you call it because the question is is it autoimmune or not. So let's move on to thyroid. So in the thyroid, there are basically two things that you can attack that we're going to talk about. There's thyroid peroxidase, also known as TPO, and there's thyroglobulin, TGB. And inside your thyroid gland, you use them to make your thyroid hormones like T4 and T3. Now, when your immune system starts making antibodies and you start destroying TPO and TGB, over time it's going to affect your ability to make T4 and T3, and you're going to become hypothyroid or low thyroid. Now, here's a list of some low thyroid symptoms. This is a partial list. You get fatigue, easily gain weight or can't lose weight, even on a low-calorie diet, hair loss, depression, constipation, brain fog. These are all very, very common low thyroid symptoms. Now, if you've got TPO and TGB antibodies, those antibodies can be detected way before your TSH is abnormal on your lab test. Now, TSH stands for thyroid stimulating hormone, and I'm just going to tell you, I could talk for 8 hours on this topic. Most doctors mean well, but they only order the bare minimum of things on a thyroid panel to find out if someone's got a problem. And the big important thing to know about Hashimoto's is all you need is the antibodies. If these antibodies show up high, that is enough to make you feel terrible. Your TSH doesn't have to be abnormal for you to feel bad. This condition is called Hashimoto's, and I want you to remember this more than anything else. Hashimoto's is the #1 cause of hypothyroidism in the United States. If you've got low thyroid or been diagnosed hypothyroid and you haven't been checked for Hashimoto's, you need to be, because there's almost a 90% chance that you do in fact have Hashimoto's. And to get correct treatment and to stay healthy long term, you've got to make sure you deal with that underlying autoimmune problem. Now, there's another kind of autoimmune thyroid condition called Graves', which is a hyperthyroid, and these antibodies can show up in that. And vitiligo, you also get thyroid peroxidase and thyroglobulin antibodies that show up in that. And if you don't know what that looks like, here you go. Vitiligo is when, this is obviously someone who's African American, and it destroys these melanin, this color in your skin. Michael Jackson had vitiligo. Caucasian people can get it as well, but it's really noticeable in someone that's got darker skin. So that is the endocrine diseases that celiac and gluten sensitivity can lead to, and some of the symptoms you need to be aware of and the antibodies that show up. Let's talk about some neurological diseases. I, myself, have this one. There's this enzyme that's called GAD65, right here, glutamic acid decarboxylase. And what it is, it's an enzyme, and it helps you convert glutamate to GABA. Now, GABA is an inhibitory neurotransmitter, meaning it kind of slows things down, it's kind of calming. Glutamate is an excitatory transmitter. So GAD helps you convert the gas pedal to the brake pedal, that kind of thing. Now, GAD is also made in the pancreas in those beta cells we were just mentioning. So, if you have GAD, the enzyme that's being attacked, you can be prone to anxiety, ADHD type symptoms. You can actually get some kind of neurological symptoms where you can get poor coordination, you can get seizures. In autistic children, we see autistic kids that have really bad meltdowns and tantrums. A lot of those kids have got these GAD antibodies because they can't slow their brain down. You can also see what's called cerebellar ataxia, which is a neurological condition where your coordination is terrible and you're very wobbly. You also see GAD antibodies in type 1 diabetes, which we were just talking about. And you see it a lot in celiac disease. You can also get another neurological condition called stiff person syndrome, and again, latent autoimmune diabetes of adult. So that is GAD65 antibodies. Synapsin antibodies, there's not a lot to say about this other than, it's a little protein. at the synapse or the connection between two neurons, and it's involved in releasing neurotransmitters like serotonin and dopamine and acetylcholine. And if you get antibodies to synapsin, you have trouble releasing these neurotransmitters. And it can cause a whole range of stuff, everything from depression and ADHD symptoms to brain fog. And you can see synapsin antibodies in demyelinating diseases like multiple sclerosis. The next one here is called, a mouthful, asialoganglioside GM1. And really all it is a protein. It's a molecule that's in nerve tissue. It's not really a protein. And it's important in nerve cells communicating from one to the other. If it gets attacked, mainly what you get with this is you get neuropathic symptoms, meaning you can have muscle weakness, numbness and tingling. You can even end up with more cognitive stuff like obsessive compulsive behavior, repetitive tics, like someone that has a repetitive little motion. You can develop ADHD type symptoms, hyperactivity. Now these antibodies show up, and this is the reason I have this slide, in the following situations. Number one, head trauma. You get in a car wreck and you whack your head on the windshield, and then you start to get numbness and tingling in your arms. It may have nothing to do with a disc, right? It's not a herniated disc. It could be you've got antibodies to this molecule, and it's an immune system problem, not a orthopedic or a structural problem. These antibodies show up in people that have had strokes. They show up in people that have conditions like chronic inflammatory demyelinating polyneuropathy, motor neuropathies, sensory motor neuropathy. They show up in multiple sclerosis, in conditions like myasthenia gravis, which is it's kind of a muscle weakness that moves from your head down, and Guillain-Barré, which is kind of the reverse of myasthenia gravis. This again is a muscle weakness condition that usually starts in your hands and legs and moves up towards your head. It can also show up, and I'm putting this mainly for those watching that have kids, these antibodies can show up in kids that develop PANDAS type symptoms or OCD symptoms, kids that develop acute onset obsessive compulsive behaviors. This needs to be checked. Purkinje cell antibodies. We're going to talk about a place called the cerebellum. Now the cerebellum is in the back of the brain, and Purkinje cells are these beautiful, huge tree-like cells that are in the cerebellum. Now there are these very large nerve cells in the outer layer of the cerebellum, and they're really important for making things smooth and accurate, such as your movement, your balance, your coordination, even your thought. Now when you get antibodies and you attack these Purkinje cells, you can get new onset motion sickness. So if you're 35 years old and you've never had motion sickness in your life, and all of a sudden now you've got a problem with motion sickness out of nowhere, you need to have this checked. They can cause chronic nausea, vertigo, dizziness, make you feel lightheaded, make you be clumsy where you hadn't had these problems before, give you all kinds of balance issues. And where do you see these? Well, again, we see these Purkinje cell antibodies in autism. In fact, autoimmunity is a huge portion of autism that most people just completely overlook, and I have found it to be really important. You find these Purkinje cell antibodies in celiac disease, and this condition called gluten ataxia, and vertigo like we just mentioned. A couple of specific vertigo conditions include Meniere's disease and BPPV, and you can find them in tremor. Now, remember our good friend cross-reaction? Cerebellum antibodies cross-react with gluten and milk. So if you're eating gluten and milk and you've got cerebellum antibodies, this is not good. So this is why I always tell people, if you've got an autoimmune condition, you cannot have gluten, you cannot have milk. Another thing I want to point out is that mercury is a very key complicator and instigator in cerebellar antibodies. So I see I'm starting to get short on time, so I'm going to speed up just a tad here. My least favorite autoimmune condition people have is called antiphospholipid antibodies. Phospholipids are in every one of your cells. So if you start to attack phospholipids, you can get a whole wide range of effects. You can get effects such that you are now increased clotting risk. You can get the opposite though. You can get low platelets and you can get an increased bleeding risk. You can develop systemic lupus. You can develop first and second trimester miscarriages, which I see all the time in my patients that are complaining of infertility. And you can get this non-insulin dependent diabetes that happens. Now, phospholipids can also show up as neurological symptoms. They can show up as movement disorders like chorea and tremor and myoclonus. And we see phospholipid antibodies, again, in autism and in PANDAS and OCD, where kids get new onset of obsessive compulsive type behaviors. Got to check them for these phospholipid antibodies. Now, a major clue to whether someone's got these is if they develop patchy hair loss, like you see in this image here. Now, not like male pattern baldness and not diffuse, but they start getting like little coin-sized bits of hair that are falling out. Almost 100% that person's got phospholipid antibodies. I was going to go over a couple of quick cases, but I mean, here's 4 people, or actually 5 people in the last year that I found out had phospholipid antibodies, and the major clue was they had patchy hair loss. Now, this was critical for them because now we know that they've got this autoimmune octopus, and we've got to treat them correctly. So let me just tell you real quickly, how do you stop that gate from opening? Well, here's the deal. If you already know you've got celiac or you've got gluten sensitivity, whatever you want to call it, you have to stop eating gluten in all sources, and you have to stop eating milk products. And there's mainly because milk is a huge cross-reactor with gluten antibodies. And there are some other cross-reactive foods. I've got a YouTube video series on it you guys can look up. So you've got to not eat those things, which seems obvious. And then you've got to work with a doctor who understands all this immune system business. I mean, if your doctor doesn't understand how the immune system works, doesn't understand about antibodies and T cells and cytokines, then he's going to have a hard time helping you. I mean, that's just the truth. Your doctor has to be able to understand this stuff here on this slide, which we didn't even go over. It's got to understand NF-kappa B, glutathione recycling, all the barrier system problems you can have, cytokine polarity. So basically, to get the right help, your doctor has got to understand cross-reactors, and again, I've got a YouTube series on that, NF-kappa B, nitric oxide, cytokines, glutathione, recycling, leaky gut, and everything that affects it's got infections, loss of chemical tolerance, mycotoxins, genomics, and SNPs. So that's how you stop the gate. You got to find a doctor that understands this stuff and start working with them to find out what's going on in you to stop that gate. Now, I'm going to leave you with this. Your next step is, number 1, work with the right doctor who understands all this stuff. Get the right testing using the Cyrex test and get the right treatment. And the right treatment is working with someone that understands that whole list of bullets I just found. Now, I do have a couple of free guides for you guys that you can get at this link here, which is drdavidclark.com/free guide to testing, where I'm going to, again, review the Cyrex testing for antibodies for multiple tissues like autoimmune, as well as the antibodies for gluten and celiac. And I had a wonderful time. I have 8 hours more stuff we could talk about. I really, truly hope this has been helpful for you. And just let us know how it goes and make sure you get your free guides, and maybe I'll talk to you soon. Thanks so much for attending. I appreciate it.